etiology. Exact etiology is unknown, and familial is more than 50% of patients with total colonic aganglionic are affected. Relative and genetic factors also there. It's an autosomal dominant condition and commonly associated with Down syndrome or trisomy 21. Main factor exact etiology is unknown, but it occurs due to any type of the familial history the patient is having or any type of the genetic disorders. And you can see the pathophysiology of the Hirschprung's disease may be occur if having any due to the absence of the ganglionic cell. We already told the ganglionic cell helps to the movement of the stool from the colon to the rectum. If having any absence of the ganglionic cell, that means a ganglionic is there, means there should be a lack of peristaltic movement in that affected portion. Where it is the ganglionic cell is absent, there should be a lack of peristaltic movement. That maybe leads to the obstruction in the colon, and this leads to obstruction leads to the accumulation of the gas and feces in that particular part. That maybe leads to the enlargement of the colon. What should occur? Maybe occur due to the absence of the where it is the absence of the ganglionic cell, there should be an obstruction will occur. That obstruction will lead to the enlargement of the colon. This is the pathophysiology of the condition. Then clinical presentation, about 40 to 64% of cases are diagnosed within 1 month of age. It is a congenital. We already talked about it is a congenital disorder. You can see it is occurring 1 month of the age. We can identify within the 1 month of age. And clinical presentations are different depending upon the patient's age. The clinical presentation also differ for the neonates and also the older children. We can see one by one. And features in the newborn period. What are the things we can see during the newborn period? Abdominal distension. If the megacolon is there, means the baby will have the abdominal distension. That 30 to 90% of the children have this condition. And also the baby have bilious vomiting and constipation, failure to pass meconium within the 48 hours. Normally, a neonate will pass the meconium within the 48 hours. In this condition, the baby not able to pass the meconium within the 48 hours of the life. Then reluctance of the ingest fluid, fever, and also the sepsis. But if these symptoms are there, means we can't diagnose it is the patient having Hirschprung's disease. Some other condition also have. So each child including presentation, bowel movement in the first 48 hours in life does not rule out the Hirschprung's disease. We can rule out if these symptoms are there in the neonates, we can't predict the baby having the Hirschprung's disease. Some other conditions also have these symptoms. And in infants there is a infrequent stools. Infrequent stools or diarrhea with abdominal distension, sleeve with rectal stimulation and enema. In the case of the infant, we can see sometimes the baby having infrequent stools or otherwise diarrhea with abdominal distension. Then constipation for the several days. Then the baby have failure to thrive and loss of appetite and also the delayed growth. And older infants and children. In older infants and children, you can see the constipation. 68% of the children are having constipation, and the 64% of children are having the abdominal distension and vomiting also there. And the baby will have a history of constipation in older infants and children than the neonates. In older infants, we can see the history of constipation for a long period of time. Then ribbon-like foul smelling stool also present. Why this occurs is there should be a ganglionic cell is absent. In that case, there should be obstruction will occur. In colon, narrowing pathway will be due to the obstruction. In that colon, there should be a narrowing pathway is there. In that pathway, the stool will pass like a ribbon. Ribbon-like stool will be occurring.